Hey Foot Geeks fans, it's CJ here with Heather from Divine Elements, and today we want to talk about knee pain and how prolotherapy can help treat that, or how naturopathic doctors treat that.
Hi, I'm Dr. Heather Vandergiesen and I work at Divine Elements in Kitsilano, and I'm a naturopathic doctor, and for the most part my practice is a lot of acute and chronic pain management and injury prevention. So that being said, I do see a lot of knee injuries, and with knee injuries I'm not just looking at the knee when somebody comes in with an injury, I'm also looking at how their whole structural alignment is in place, because sometimes if there's a knee injury it means that there might actually be something else out in the body, whether it be their hips are out of alignment, they may have a flat foot, or their ankle has been injured and they're compensating, and that's what's actually hurt their knee. Yep. Otherwise, it could be from any kind of plant and twist type injury, and that's where we're seeing a lot of the ligament knee injuries, like ACL, MCL.
And how do you treat it with
naturopathic medicine?
Naturopathic medicine, yes.
So I'm looking at always trying to treat the root cause and trying to treat the person as a whole. So I'm going to be looking at what their diet is like, because if we don't have the proper nutrients in our blood, a lot of our injuries are going to take a lot longer to heal. Mm-hmm. So that's one of the main areas that I like to treat, or one of the base kind of treatment things that I do.
So basically take the inflammation down in the body through nutrition, right?
Absolutely. Inflammation, and also just getting those nutrients into the blood so that there is those nutrients to help it heal. Mm-hmm. Sometimes I'll use IV nutrient therapy, and what that's doing is it's taking out the digestive system with getting our nutrients, and it's putting it right into the bloodstream. So our cells have first priority over getting the nutrients that it needs in order to help the rest of the body heal.
So what's inside the IV? Is there vitamins in there? Or?
Yeah, vitamins, minerals, amino acids, and different combinations of those in order to, and they're specifically tailored for each individual. So I always have a consult with the patient to know exactly what they need, so that I make that individual bag that's going to help them the most.
Okay. So it's different than what you would get in a hospital bed, for example?
Absolutely. Yeah, so in the hospital you may be getting fluids if you're dehydrated, you may be getting antibiotics, you may be getting glucose if you're diabetic and you're really low, have low blood sugars. But yeah, these are mostly vitamins, nutrients, minerals, amino acids that our bodies need, and we usually get them from food, but sometimes if we're not absorbing things properly, or we have an injury where we're actually just needing more nutrients to help heal that injury, an IV is a great way to go.
And then aside from using food as therapy, I mean, what else do you use to treat any injury in that respect?
Any injury. So I may do physical adjustments like a chiropractor, where I'm structurally just aligning the body to make sure that it's in alignment, so when I'm treating that injury, everything else is also in place. So I'll do adjustments, I'll do massage, or just trying to release any kind of tight muscles, because usually when we have an injury, the muscles around it will get very tight in order to protect it, and it's our body's own defense mechanism.
Okay.
So then if it's a lot of ligament or joint trouble, then I'm going to use what's called prolotherapy. And prolotherapy is an injection therapy. It's also called regenerative injection therapies. It contains dextrose, or a sugar solution, as well as an anesthetic like Procaine, and we're injecting that into the enthesis point, or where the muscle and the bone connect. Yeah. And just trying to help rebuild and strengthen those ligaments and tendons that may have been either not fully torn, but either slight tears that need to heal up, or if there's any laxity due to repetitive stresses.
Okay. And what about exercise therapy to try to make those muscles and tendons stronger?
Absolutely. So once we've got that injury stabilized, then I'm going to promote, along with physio and chiropractic adjustments, I'm going to incorporate some exercises into their therapy so that it builds stronger and we're able to get a more balanced group of muscles to work together, so that injury doesn't continue to reoccur.
Excellent. If you have any other questions regarding knee injuries and how naturopathic medicine or prolotherapy can help relieve pain in those areas, please post your questions